Cinnamon, even though it's just a spice, it has lots of benefits, and we've recommended it to some of you because of insulin resistance. It greatly improves your insulin responsiveness. Therefore, your blood sugar will get better. We've had lots of folks in our practice that are pre-diabetic, and they get on the low glycemic diet and get on the cinnamon, and they drop their sugars 20 and 30 points. And if you do that, then your insulin's working better. You don't have to make so much insulin, and so your pancreas is happier, and we can prevent that diabetes. Cinnamon reduces the inflammation in the lining of the arteries. We talked about how inflammation is what causes the artery to break down and the plaque to rupture. So we use it for people that are insulin resistant or diabetic or folks that have inflamed plaque. There are a couple of precautions. If you have liver disease, there are some concerns that it might be toxic to the liver if it's already unhappy. So you have to discuss that with your doctor. Breast and prostate cancers are what we call hormone responsive cancers, meaning estrogen and testosterone make them grow. And somehow cinnamon seems to also stimulate those particular tumors, or there's evidence that it might. So in those folks, we wouldn't use cinnamon. It can also affect blood thinner, specifically Coumadin, so not aspirin and fish oil, but people that are on Coumadin or other prescription blood thinners, we have to be careful with it. We want the diabetics to monitor their sugar because it might drop too low. They may have to get off of some of their medicines, so the risk in them is that they would have too low of a blood sugar. So always let your doctor know if you're using the cinnamon. Our approach is the Cinnamon Plus. The company that we like is Alphabetic. There are actually 3 ingredients in that all help with your insulin sensitivity. I have insulin resistance myself, and I sprinkle it on my food, or I pour it in my Metamucil in the morning. It makes it taste a little bit better. We recommend the glycemic load diet because of how it improves your insulin sensitivity. And then Paul and Casey would recommend the resistance and interval training programs to help with insulin sensitivity. And all of that goes back to Carla's question about what are things that help us to lose weight better. Almost without exception, insulin is what's driving the weight. So if we make the insulin better, the weight automatically gets better. There is a book that just came out, Good Calories, Bad Calories, if you're interested in reading some of the science behind that diet. Gary Taubes, Taubes, is the author. And he goes through the history of weight loss efforts and what the science has told us. Very, very good read.